Okay, welcome back. This is Dr. Jin Sung. Today is Tuesday at 12:30. Today we're going to be talking about autoimmune disease. So in order to understand autoimmune disease, we have to explain a few things, right? When we say auto, meaning self, it's a disease where the immune system, your own immune system, is attacking your own tissues. So in order to explain it, what I like to do is explain your Th1 and a Th2 system. Th1 system is basically a cell-mediated system, the T cells. Basically, when you have an infection, you have something that comes into your body like a virus, you have an immediate immune response. That is your Th1 system. So typically the Th1 and Th2 system needs to be in balance. It has to be in kind of like a seesaw. And the immune system is very dynamic. So when things happen, it will shift. So when you have a virus or a bacteria that comes into our system and your body needs to fight it off, it will shift into a Th1 dominant system. Okay? So it will have the ability to fight off an infection, a virus, etc. That's something very acute. Your other system on this side is the Th2 system, and that is your B cell or antibody mediated system or humoral system. So basically, you're able to fight off a bacterial infection, a virus, or whatever it is, or childhood diseases, and your body develops a memory for it, right? It develops antibodies for it. So your Th2 system will shift, right, in order to be able to recognize those things and have an immune response. Generally, in a healthy individual, you're going to have a balance of the Th1 and Th2 system. And what balances those two systems, right down in the middle, is your Th3 system. So you have Th1, Th2, and your Th3 system on the bottom. Your Th3 system is the referee between the Th1 and Th2. Your Th3 will regulate your immune system. It's called your regulatory T cells. So it helps to modulate your immune system so it does not overreact. But it also has the ability to push the systems. So let's say a virus comes in, your Th3 system will produce cytokines or messengers that will signal a shift in your immune system so you can fight off an infection or a viral pattern. Okay? So in a healthy individual, your immune system is very dynamic. It will shift as necessary. However, it will always come back to that neutral position. So it'll be in a balanced position. When you have an autoimmune disease, what happens is you'll have a shift without an antigen, or it will shift and it will stay shifted. It will never come back into a balance. So let me give you an example. If you have, let's say, Hashimoto's thyroiditis, you have a thyroid problem, okay, and your immune system is constantly attacking it, we have to find the underlying trigger for why that autoimmune disease manifested. So what is triggering your body to attack your thyroid gland? One, it can be a hidden infection, right? It can be a pathogen in your GI tract. It can be a heavy metal. It can be deficiencies, nutritional deficiencies. It can be hormonal fluctuations. It can be sugar dysregulation. All these things can play a part in terms of shifting your immune system. In autoimmune disease, that shift will occur but never come back into its normal position, or may come back but it's always shifting, right? And your body's immune system will recognize your thyroid as a foreign antigen. It will attack it because it thinks it's a foreign tissue. Now, there is something called molecular mimicry. So certain proteins, like gluten, certain sequences of it, will look like the thyroid gland. So if you have sensitivity to gluten, then you may develop issues with the thyroid gland because certain sequences of that gluten protein looks like your thyroid gland, right? So every time you expose yourself to gluten, then you are attacking your thyroid. And then your thyroid, to a certain extent, looks like your cerebellum. So therefore, your next area of attack could be your cerebellum. So we have a lot of patients who come in with thyroid disease or autoimmune thyroid disease, right? And it's creating fluctuation in their hormone. They're not feeling well. They're losing their hair, their eyebrows, constipation, fatigue. All these things can happen. Well, however, when we do a physical exam or a neurological exam, what I find in these patients are that they have balance issues. So thyroid antibodies, right, affecting the cerebellum to a certain extent, and the cerebellum will start to degenerate, causing balance issues, maybe some what we call dyskinesias, where they'll see a shake in their hand as they point further out from their body, right? So it creates issues not just in the GI tract with gluten, but it also cross-reacts with the thyroid, and the thyroid cross-reacts with the cerebellum, and now you have a cerebellar problem, a balance problem, right? You have cognitive problems, eye movement issues, and then you have a thyroid problem on top of that, and then you're allergic to gluten. So these are all factors that play into what is the underlying cause for autoimmunity. The other factors for autoimmunity is this. Maybe your body is not attacking your thyroid itself, or let's say your liver or your skin. Maybe it might be the fact that we have so many toxins in our environment, right? And these toxins, let's say a heavy metal, will attach to your tissue, right? And it kind of changes the molecular structure because it attached to it. Yet your immune system goes, hey, I don't know what that is. It's no longer thyroid. It's thyroid plus a heavy metal, right? And then your immune system will have a overreaction to it and will start attacking it. So in a very deep sense, it may not just be that the immune system is attacking the thyroid gland purely. Maybe your thyroid gland has an attachment of a foreign toxin, and then your body will have an immune reaction to it. So the autoimmune disease population has exploded, basically. There are about 24 million Americans diagnosed with an autoimmune disease. And they say that's only about a fourth of the total number of autoimmune patients. So we're looking anywhere from 75 to 80, 90 million people who may have autoimmune disease. And a lot of them do not know they have it. And that is becoming a big issue. The advent of all the chemicals and toxins that are unloaded into our environment, GMO foods, hybridized wheat, EMF or electromagnetic frequencies that are in the environment, all those things will play a part in terms of an autoimmune disease. It will change how your body reacts to things. And whenever your body is under constant stress, your immune system will dysregulate. It will create a shift in that Th1 and Th2 system, and it creates havoc within the immune ecology or immune system, right? So when we look at how do we take care of patients who have autoimmune disease, you have to be able to eliminate or at least find the triggers, right? Is it food triggers, right? Do we have an inflammatory response to food? Do we have a toxin that's in our system? Whether it's an herbicide, pesticide, genetically modified food, heavy metals, right? You have to find the triggers. Once you can find the triggers, you have to eliminate them. So if someone is allergic to gluten or has sensitivity to gluten, and they refuse to stop eating it, their autoimmune process will never subside. you have to be able to remove that trigger. So eliminating the triggers, eliminating the toxins, eliminating the parasites, eliminating the heavy metals, eliminating the mold, all these things matter in terms of recovery for autoimmune disease, right? One of the most important nutrients in this autoimmune disease fight is going to be vitamin D, right? Vitamin D, for people who have autoimmune disease, you need to get the levels up because it helps modulate your immune system to a certain extent. When you have your Th1, Th2, your Th3, the referee, your vitamin D helps your referee. Things like glutathione will also help your referee, your Th3 system. So it's very important for you to modulate or help the Th3 system so you can modulate the other two systems. It is crucial for you to have those nutrients. Essential fatty acids are very important also. You need vitamin, maybe cod liver oil, sardines, certain fishes. We also use something called phyto-DHA to help brain function. So essential fats, right? Essential fatty acids are very important for immune modulation. And there are other nutrients that will be helpful. I just explained your autoimmune process in a very simplistic terms, right? It's a very simplistic model of what the whole autoimmune process is actually doing. So next week, what I'm going to do is go a little bit deeper into autoimmune disease. What is it? Name some of these diseases and look at things like different toxins and parasites and those types of things, and go deeper into how to help patients with autoimmune disease. Okay. I'd like to give a shout out to my two beautiful daughters who are probably watching today. They are home for election day, so they are probably watching. So Daddy loves you, all right? And I'd like everyone else to subscribe and also share with other people, because we want to be able to spread the word, because what people are getting within the medical model, or the traditional medical model, is symptom-based care. What we need to do is to go deeper and find the causes of all the symptoms. All right? So we'll see you back next week, Tuesday at 12:30. I want you to guys have an awesome day, and we'll see you back. Take care.